Good evening, everyone, and welcome to tonight's Our Community, Our Health Forum titled Breast Cancer Research and Me, Everything I Wanted to Know. We'd like to thank everyone for taking the time to join us tonight, both those who are attending in person here at HealthStreet and those joining us on the web. This town hall is funded by the UF Cancer Center and jointly sponsored by HealthStreet, a community engagement program in the Department of Epidemiology, and funded by the Clinical and Translational Science Institute and Science and UF, an outreach program of the STEM Translational Communication Program in the College of Journalism and Communications. Our goal over the next hour is to provide an opportunity for community members to ask our panel of experts questions about the role of research in advancing the care of patients with breast cancer. Now let's meet our panelists. Dr. Karen Daly is a clinically based investigator and educator with a focus on breast, gastrointestinal, and gynecologic cancers. She's dedicated to increasing available research studies so that every patient may be offered the opportunity to participate. She's also interested in resolving access to care barriers in disadvantaged populations. Rebecca Bush is certified as a clinical research coordinator by the Association of Clinical Research Professionals. Rebecca provides research support for studies funded by the National Institutes of Health with the Pain Research and Intervention Center of Excellence, known as PRICE. Lisa Merck-Edwing is a 20-year breast cancer survivor. She has participated in a breast cancer research study, and she will be sharing her experiences with treatment decision-making. And we'd like to start by talking a little bit about what breast cancer research studies are so that the audience will be familiar with that idea and where we're going from there. And Dr. Daly, I'll start with you. Can you tell us what a breast cancer research study is and why they're important?
That's a broad question, but I will try to tackle it. There are many breast cancer research studies that have been done over the years that have actually led to the treatment that is standard of care today. So really, even when you're receiving standard care, you're benefiting from research that's been done previously. I think the most common kind of research studies we think of are research where it involves a difference in treatment than is standard of care, perhaps the addition of a new drug. But there are many other kinds of research that are done in breast cancer, including registries where clinicians or investigators will look at patterns of treatment and outcomes, supportive care trials where it's not a question of changing treatment, but it's adding medicine to help combat side effects of treatment, for example. Those are some of the kinds of breast cancer research that are actively ongoing.
Okay. So there's a lot to choose from once you get into the field and begin to understand the wide range of what's being attempted and for different reasons.
Yes.
Okay. Lisa, what about your experience with, and we'll get more in depth a little bit later on about your specific experiences with the treatment that you went through and the research that you were involved with. But as we talk about the importance of this, I think it's good for the audience to hear early on from someone who has had that experience. Why is it important to you to be here?
Well, because we all need research. When we all use research, whether we realize it or not, and even 20 years ago when I was first diagnosed and making decisions on standard of care, I looked to research. I asked my doctor, well, what are the statistics? Where did those statistics come from? They came from people participating in trials, and that helped me make a decision on standard of care drugs. I wasn't entering a trial at that time, but that helped me. So now I'm on the other side. I'm in a trial, and in the future, people will be looking to the trial that I'm in or the research study that I'm in to help make their decisions. So it's a circle of bringing the community back into the individual.
Okay. And Rebecca, you're very involved with bringing people into that process. Why is it important to you?
That is important because that way we can get a sense of different types of participants coming into the study. We want to get every type of person that we possibly can because treatments are different, work out different for each person.
Okay. As we go through this discussion tonight, we'll also have some audience questions, and people will be tweeting questions to us as well. So we will be asking audience members to submit their questions, and I believe we do have one from the audience right now.
So I would like to ask, who are the people actually involved in these research studies?
Okay, who are involved in the research studies?
I'll take that.
Okay.
So for the research studies, you have the sponsor or academic facilities that fund the research studies, and then you have the principal investigators who head those studies, along with other co-investigators, medical professions such as nurses and doctors, and then you have the study coordinator and other research staff to help conduct the studies. And then you have the Institutional Review Board, the IRB board, that oversees research studies to promote and help protect your welfare as a participant.
And we also have folks submitting questions via the Twitter sphere. And we do have a question from Twitter, and that is, how are people selected to participate in the studies? Can we talk a little bit about some of the criteria, Dr. Daly?
Sure, there are a lot of ways that people come to being in a study. One is that their own physician or treating clinician presents it as an option to them. Some of the time, what happens is behind the scenes, there are clinical research staff which are screening, for example, lists of new patients or patients presented at multidisciplinary conferences to identify patients that are eligible for studies and to let them know during their standard of usual clinic visits about the opportunity to participate. There are patients who look up studies on their own, and we can talk about some ways to do that tonight. Probably the best known resource is the website clinicaltrials.gov. G-O-V is a national website that can link patients who are interested or physicians interested to clinical trials throughout the country. Those are some of the ways patients come to know about a clinical trial, and there's usually a list of both eligibility and ineligibility criteria to identify patients, and that's something that the research staff usually will help screen the patient and see if they fit that particular study.
Okay. And Rebecca, what is your role in that process in helping with the selection of patients? Are you involved with that?
Yeah, so I would help recruit patients for the studies, and so we would screen them to see if they're eligible for the study.
Okay. And Lisa, what was that process like for you? Was there more than one study that you were looking at or asked about? How did you first get involved?
Most definitely. The second time that I was in this process, I was brought to my attention by my doctor. And yes, I looked at the study. I met with the research doctor. And then I went to another facility and Moffitt Cancer and discussed with them. They had a similar. So there was a going back and forth, and they gave me their honest opinion. And actually, one study, said you're better off in another. So sometimes people have a feeling that you're almost going to be stuck in a study. Their concern is your health, and that is first and foremost above their study. So they did not recruit me for their study, but said, "No, you're probably better down in your local community with that study." So that was, I thought, wow, that's nice of them. You had this preconception that wouldn't occur, and it does. Their priority is your health.
When it comes to recruiting patients to take part in the studies, I understand that there are times when enough patients aren't recruited for a research study. So it sounds like there are some challenges involved to finding enough patients who meet the criteria and are willing to do it. Do you find that being involved in research studies, is that a significant challenge or a significant part of that process for you?
I think it really depends on the study. We see some studies that enroll patients, get all of the patients that are necessary to answer the question. very, very quickly ahead of schedule. Sometimes there's a really promising drug and information about that is circulating in this example to the breast cancer community, and patients are really seeking that out. And so sometimes we have the other kind of side of that. But you're right, sometimes depending on the particulars of the study and how maybe selective the entry criteria are, if there are a lot of restrictions to who would be eligible, obviously that's a trial that's harder to find a small group of patients, a very specific group of patients.
Okay. All right, and we have another question coming in from Twitter. Everyone needs research. Is there a point at which the research we help with becomes available to the public?
That's definitely true in cancer research, because this is the way that new drugs come to be approved by the FDA. The FDA requires that research be conducted to show that they're both effective and safe. So this has shaped clinical care in breast cancer to date, and all of the new drugs we have really are approved based on this. So it's a really relevant question, and absolutely participating in research improves cancer care and treatment, and in real time actually. So it's surprisingly fast sometimes in breast cancer how patients will enroll in trials, and not very long after the results are available and presented at a meeting, published, and the next day the drug is available for use in the clinic. So it's really a very dynamic process.
And that's very exciting. And Lisa, I would think that would be somewhat empowering for you to be part of that process.
Oh yes, most definitely. I mean, I think an example of a drug that was fast-tracked, I believe, was Ibrance, when they had good results. And that is a similar drug-targeted therapy to what I'm currently on. So yes, I mean, to be part of that and you know, it's very exciting and exhilarating, because, you know, when you're in that situation and you get good results, it's wonderful. You have access to that cutting-edge technology, and people here in this area are so lucky that they live in a community with in the university where they can have access to this expertise knowledge.
I'd like to move on to a slightly different focus. What makes a breast cancer research study different than other kinds of treatment, Dr. Daly?
I think you mean it compared to standard of care treatment. I guess that's the question that we're trying to get at. In breast cancer research, typically a treatment trial will involve standard of care, which is the best known therapy now in 2016, compared to the other group of patients who are getting that same treatment with an additional drug, for example. So there is not a comparator arm, a group of patients typically who are getting no treatment or getting a placebo treatment. It's usually what's the best thing we know to do now versus something that is suspected based on evidence in the lab as potentially being superior, and so that's the usual question being asked.
Okay. Is it common for people to think when they're first, if a doctor approaches them about, say, taking part in a research study, is it common for them to assume that there might be treatment they are missing out on if they do take part in that study?
I think that's a common concern, and I think that's why programs like this are so important, is to get the word out to the public and to the cancer community that that is not a common design, nor would anything like that go through all of the regulatory boards that we'll discuss, you know, in more detail. But there's a lot of regulatory authorities that make sure that by the time humans and people are enrolling in studies, that it's safe and that it's ethical and that it is likely to be beneficial or unlikely to be harmful.
Okay. And Rebecca, have you heard that from patients as they've talked to you about their concerns and their questions about what will the experience be like? Do they ask, am I going to be missing out on something else?
Yes,
in terms
they
of
have.
treatment?
Right. And that's where, it's, as we said, like, we need to make sure the public is aware of the different types of studies that are out there.
Lisa, did you ever have that concern? It sounds like you were ready to just leap right in, and we'll talk about all of that tonight. I want to make sure everybody kind of knows your story, but was there a moment where you thought, what if I don't get something else because I'm doing this?
No, I knew that this was an opportunity to get more, a better access to more than I could if I gave up that opportunity to go into research. I knew that I would be getting standard of care, but I actually knew that I would be treated better if I were in a research. I would be getting better than standard care. I would be watched closer as a patient than if I were outside of the study. So I was very happy to hear that, and I had doctors say that to me, you know, that it is better to be in research because you're watched very closely throughout the process.
Okay.
I think that's a really important point. If I could just
Sure.
tack on to what Lisa was saying, we have, I think, very interesting data that patients that participate in research studies but are assigned to the standard of care group, when there's a study where there's a standard care group and a investigational drug group, even the standard of care group does better than patients not on study. So why is that? And perhaps one of the reasons that's been thought is because of all that close monitoring that you're mentioning, and extra oversight and a whole other set of eyes that looks in on your case, your labs, your imaging studies, and makes sure that all the I's are dotted and T's are crossed.
Yes, and they respond very quickly, you know, and you have access to, at least I have in my study, access to my doctor quite often. You know, every time I'm there, even if it's not my time to see him, I have access to him, very open, so.
Good, and I would think that would be reassuring. Okay. We do have, I believe, another question from an audience member. If you'd like to say who you are and share your question with us.
Sure. My name is Keith Silverfeld, and I think we answered the first part of my question, which was, are the clinical trials we're talking about specifically about breast cancer? I think we've moved into those specifics. And the other thing I was wondering about is, what about patients who are hesitant to get involved in a clinical trial, thinking that there are a lot of risks? I think I would fall into that group. So I'm wondering what factors patients should take into account when they're making a decision, probably with their doctor's input, maybe multiple doctors' input, but what are the factors that are maybe non-medical that they should be thinking about? Thank you.
Well, when I was making the very first time I ever went looking for a research study was right when the genetic testing was coming out for BRCA1 and 2, because not only myself but my sister was diagnosed as well when we were both in our 30s. And so the likelihood was very high that we had a genetic disparity. So I was concerned at that time about cost of the testing. I was concerned about privacy of the results and the insurance. And I was also concerned, would it be open for all my family members to participate if they so chose to do that? So I went looking for a study that I could participate in, and I found one at Fox Chase. At that time I was living up north, and it allowed me to do all of those things. I received excellent counseling about the genetic testing, about the prophylactic steps that would occur if I came out positive, and it alleviated all of the concerns that I had. It allowed my siblings to enter the process, and in fact, my one sibling still answers a surveillance type of a study. And then more recently with my involvement with another study, the doctors go over. I mean, it is a large packet of information that covers every side effect. I mean, they even cover the risks of drawing blood, you know, and they go over it in depth with you. So really, that was alleviated there. But again, concerns of location. Where am I going for my study? How far will I travel? Because will you feel well enough, even on standard of care chemotherapy, driving yourself home and having to have people take you back and forth? That's why if you have access locally in a local community where you don't have to go that distance, that's excellent. Concerns about family members or cost and things of that nature. The ability, you wouldn't even think about it, but you know, when I entered the one study, well, can you swallow a pill? Yes, but some people can't. So, everybody's ability and everybody's level of, do I want to give up, a different activity because of time constraints? Everybody has a different parameter of what they consider when looking at this. But the best thing to do is just ask your questions, and there's no silly questions, ever, and if it's right for you, then it's right for you, and you have to make those decisions, what's good for yourself. And me personally, once I make those decisions, I never second guess them, but.
We do have another question from Twitter that we have already touched on, but I wanted to just make sure that, because someone is asking this, that we briefly discuss this again before we move on to the next part of the program. Do my doctor and my research team work together? Do they actually communicate? And does one hand know what the other hand is doing? I think might be what this audience member is getting at.
Yes, in some studies, the doctor is actually part of the research team, so they do work hand in hand. But in other studies, they are not. It is in your best interest as a research participant to inform your doctor if you're participating in research studies.
And it's time now to move on to the Center for Arts in Medicine. And we are going to take a look at the first segment that illustrates one of the challenges that patients face when they're discussing their cancer treatment with friends and family. So we'll see how that goes, and then we'll talk about what that means if you should be in a situation where you might have this experience in the future.
Hello?
Hi, Angie. It's John. You got a sec?
Oh, hi, John. It's good to hear you. How are you?
I'm doing well. How are you feeling?
I'm a little tired, but not too bad. I'm going to be okay.
I'm sorry I couldn't stop by the other night. The kids had their school play. Do you remember back in high school when we did The Sound of Music and Dad went around the house whistling for us?
Oh, my, yes. And he wouldn't stop calling me Brigitte.
Listen, I've been doing some research into your diagnosis and what's available for you in terms of new treatments. They're doing a study at the university hospital, and it's on this new medication, and I think it would be good for you to do it.
My oncologist didn't suggest that I do anything like that.
She may not be aware of this study. It actually doesn't sound that bad. You just go for your regular chemo and stay an extra hour and receive the study drug.
An extra hour at the clinic? That might not sound too bad to you, but you're not the one who's already been there for several hours being poked at and getting chemo. And if I take another drug on top of that, I'm liable to feel even worse.
But you might feel better in the long run.
And it might not. That's the thing about these studies. You never know.
But you never know if you don't try. Besides, with the study, you might beat the cancer faster. Look, they're coming up with better treatments all the time. You might get into this study and do very well.
I don't know, John. My first chemo session was awful. I was sick for days. I'm the one going through this, not you.
It's just that I feel, and the whole family feels, that this is the right move. We want to take a chance on this study so that we can enjoy you for a long time to come. Look, you might not even be in the group that gets the study drug, so why worry about it?
I don't know, John. Can I think about it?
Well, don't think about it too long. These things aren't easy to get into. Once you're in, you're in. And if you want to opt out, you can. I picked up some information for you, and there's forms to fill out, and you have to get an approval from your doctor, but I'm sure she'll agree. Why don't I stop by tomorrow around lunch, okay?
Okay, John.
Okay, good. Bye for now.
Bye-bye.
Very nice. Easy for John to say, right? Easy for him to say, well, it's just an experimental drug. Maybe you won't have it. Not so easy for her. Somebody who's probably already a little bit overwhelmed. Do all studies, and we've already touched on this, all studies do not necessarily involve experimental drugs. They look different. So let's talk a little bit more about how to allay the concerns of someone who might be in that position and has family members or friends saying, try everything, you need to look at this, and the person is overwhelmed.
I think it's best that the patient and their family go to the research studies together and understand what exactly is involved in the research study. There are many different types of research studies, and just because you are in the research study or thinking about participating, you're not locked into it. So look over the information, ask as many questions as you want, and you still ask questions throughout the research study.
Okay. Anything to add there, Lisa?
Yes, I mean, it is, everybody has an opinion, but in my humble opinion, as the person going through it, it is your ultimate decision. It's kind of, and I even look at my doctors in that way. I count them as advisors. I listen to what they have to say, and then I mull it over and I make my decision. Because I never want to put myself in a situation where, well, I didn't do it for me. I'm not a victim, I am a decision maker. So it's my choice, and then I think mentally that works as well, because if you feel you're being pushed into something by a family member, it's not going to be good. And I personally, when my sister was going through it, that was probably I say it's even more difficult than when I went through it, because it is very hard to be a family member, and you want the best, and you don't want to lose your family member, and it's difficult because you don't want to be pushy, and it is their decision, but it is a very difficult position to be in. I've been on both sides, and I don't envy the family members because it is very, very difficult on them.
Mm-hmm. I'm sure it would be. We have another Twitter question asking about research studies. Are all research studies the same? We've discussed this to some extent, Dr. Daly, but can you tell us a little bit more about the phases of research and how some of this comes to be what it is?
So some of the common phases of research involve phase 1 trials, Roman numeral 1, which typically involves a small sample of patients where they're adjusting the dose to a dose that looks both safe and possibly effective. So that's a very early phase trial with a limited number of patients participating. Phase 2 trials involve more patients. There are more patients at each phase involved. Phase 2 trials are looking more towards the drug's effectiveness, and again, looking at safety-related issues. And then phase 3 are usually the trials that are designed to answer the FDA's questions that would be necessary to allow the drug to be commercially available if it's successful. So those are designed with endpoints like improving overall survival or improving the time till a patient needs a new kind of treatment, something like that. Those usually involve large numbers of patients in breast cancer, sometimes thousands of women.
Okay. In a research study, do all of the patients get the same treatment? The science is everyone is being treated exactly the same way to make comparative judgments, I guess, about how it's working?
Yeah, I think the question you're getting at is the issue of randomization, which is a word used in cancer research studies when there's two different types of treatment given. A common randomization, which means randomly assigned, would be that half of the patients are getting the standard treatment, half are getting the study treatment. That might be one example. But not all studies are randomized or have two groups of patients. Some studies, such as some phase 2 studies, all the patients are getting the study treatment. So that would be something you definitely would want to understand when you are considering a study and signing to participate or talking to your doctor about the option.
Okay. I believe we have another audience question. If you'd like to tell us who you are and share your question with us. Hi.
Sure, my name's Amelia, and my question is, does it cost any money to participate in a research study?
Good question.
Great question. And these are all generalizations, but usually no. When we're talking about breast cancer research, typically the aspects of the care involved that are standard of care that you would have had done even if you were not participating in the study are billed to your insurance, just as they would be when you're not participating in a study. Those aspects which are above and beyond or different than standard of care, such as a different drug, if that study drug requires other monitoring, lab tests or imaging, are billed to the sponsor. I think Rebecca mentioned the sponsor before, and sponsor is a word used to describe whoever's initiating the study. That could be a pharmaceutical company, it could be an investigator from the university, it depends, it could be a cooperative group, which is a group of investigators at multiple centers, so whomever is originating the study would pay for those extra tests. What can be a cost incurred to patients is travel or logistics, which you were kind of mentioning, Lisa. So if you're opting to participate in a study that's outside of your area and you're going to be traveling there, or if you need housing there, that's the kind of thing that typically is not covered by a study. So there is loss of work, something like that. But the actual medical care usually is neither more costly or less costly than standard care.
Okay. Decision making, information seeking, as we transition into that part of the conversation, I would like to help educate the audience about where can you get your questions answered tomorrow, the next day? Where can you go for information? What is the best place to find information after we end this discussion and everyone goes back to their lives and they realize there's a point where they need this information again? Where should they go? Dr. Daly, I'll start with you.
I mentioned the website clinicaltrials.gov. And I think that's probably the most comprehensive, although not always the easiest to navigate, but it is a comprehensive website. For anyone who's a cancer patient or has a family member that is a cancer patient and that's why they're here tonight, they should be able to talk to their oncologist and say, I'm interested in clinical trials. What do you know would be available to me? And oncologists really are well versed in telling what is available at their center that they have, but also outside of that thinking, what other trials are there if the patient's interested in traveling.
Okay.
And locally, you have HealthStreet, and you have this facility that you can come to because, as you said, going through, I've heard doctors speak from Dana-Farber that say clinicaltrial.org is very difficult to navigate. So if you have a nurse navigator or a counselor and a facility that you can come to, such as this, that can help you navigate that, it's a wonderful opportunity that should be definitely taken advantage of.
Okay. Rebecca, anything else on that front as far as becoming informed, staying educated?
I think HealthStreet would be a great place because what they will do is actually get you in touch with other research studies that might be available for you.
Okay, good. We have another question from an audience member. Hello, can you tell us who you are and share your question with us?
Hi, my name is Celia Chapman. If I was considering participating in a study, would I be able to talk to other patients who have participated in research studies?
So your participation in a research study is confidential. So we would not be able to get you in contact with other research participants. However, there are some research studies that may have a patient advocate available for you to speak to or support groups.
I was going to say, I personally know people that are in the same study that I am, and I just happened to meet her through a support group. We were talking, I'm like, oh, you're in that? Yeah, I'm in that too, wow. And we've become fast friends. The other way, since mine includes chemotherapy, I see the doctor and then I go sit in a room with a lot of people who are receiving chemotherapy at the same time, and we talk, and and then we just connect. But it is nice to know. So you could always approach your doctor and see if they don't mind. I mean, as you see, I certainly don't mind talking about myself, and I'm sure there's no, ooh, you can't talk about this. There's no veil of that when you're in a research study.
Lisa, let's talk more about your story. You're involved in a research study right now, and is this your second one? Or
Yes, originally when I was 30 and diagnosed, and after that when I went through a genetic testing type research study, and then when I was re-diagnosed in 2013, unfortunately it had turned into stage 4 breast cancer, and I had extensive involvement in my liver and all my lymph nodes. So at that time, the doctor said, yes, there is a trial or study that you could participate in, and that's when I began looking, because I really wanted, in that situation, to have the best out there, the cutting edge, the advantage that I could get. So I did my research. I met with the doctor, as we said, and he told me all of the possible side effects. And I did go up to Moffitt and spoke with them. They had a similar that was in placebo, random trial. I may not get the drug, so she said, you're better off going back down where you are locally. And so I did that. And, I called up my old oncologist from 20 years ago. She had retired, but she accepted my phone call. And, I gathered all of that information and made my decision. And there was a part of the study that allowed for biopsy. And at that time, my doctor looked at me and he said, no, I do not. And he was the research doctor. He said, no, you don't have time to do that. Do not say yes to that. So, you may think, oh, they just care about the research. No, he cared more about me and said, no, you're not going to participate in that part of the study. So I was lucky enough to get in and started my chemotherapy and had the drug, which was just an oral, taking a pill. It didn't take any more time of my treatment day. So within 2 months of that therapy, I had a free and clear liver scan. So, so I was extremely ecstatic, and I'm still participating in that study. I finished my 6 months of chemotherapy, but then we extended. I did the 6 months every week, and then we extended. And we adjusted the protocol after we were done the initial, and I'm still on chemotherapy, but just I'm weaning off. So it's been 2 years, and I'm still clear, and it's a very good thing. So I'm very happy with my research, and your research team becomes basically they're like a family. You get to know them, and it's very malleable. They are looking out for your best interest, and I have found in my experience are very willing to adjust and work with you for what's working best for you as a patient, rather than, well, everybody's getting this, we have to stay exactly on this, stay within the lines. No, it's not like that at all. And I've benefited greatly. We talked about sharing information with doctors. My research doctor is an expert on the drug that I am on. He knows more than other doctors outside of the study. So he could make calls, and has made a call once when I was in the hospital, that saved me a lot of discomfort, and, really, I'm going to say he saved my life, even though it wasn't from the cancer. So to have him work with the doctors very closely is a great thing. To me, if you have access locally to research and these experts, I don't understand why more people don't come in and take advantage of it within the local community.
Well, that is great news. And on that great note, let's go back to the Center for Arts and Medicine, and we're going to see another vignette here and hear about a surveillance study, a husband who does not want to offer an opinion even though the wife is asking for one. Anybody ever had that experience before? So let's see how this one goes.
Jim, could you come here? I need your help with this.
Sure.
Morning.
Morning. I've been just going over this research study.
Really, more treatments?
Well, yes and no. It's called a surveillance study, and what they would do is I would go to the hospital on a regular basis, and they would scan me, and the study would last about 2 years.
Really, 2 years, okay.
It may provide me with information if my cancer came back and early detection.
Do you know how often you'd go?
No, I don't know that yet. But my main concern is that I would have to get to the hospital and back on a regular basis. And I know that could put a real strain on you. You've already done so much.
Well, if it's important and you need to get it done, then we'll make it happen.
Really, Jim? Are you sure?
I'll ask at work, we'll get some time off.
You've already taken so much time off for me.
Yeah, but Michael's a great guy, and I'll talk to him, and I'm sure we can make it happen.
But do you think the study is a good idea, Jim? Should we do that?
Well, I don't really know. What does your doctor say?
The doctor said I should go over the material and then discuss it with you.
I think the decision's between you and the experts. I can't really help you with that, but, I really do have to go. So is there anything you need from the store before I head out?
No, I've just gotten done with cancer treatments, and I don't want to be a cancer patient anymore.
Gonna work out, sweetheart. It's all gonna be for the best, and it'll be fine, but I really do have to go.
Okay.
Beth is asking for some support, maybe just some confirmation. Yes, I think you should do it. We'll make it work however we need to make it work. And he's kind of there, but not quite. Maybe he's afraid of being the one to make the wrong decision for her. So there's some real emotional conflict there. What should the role of the family members and friends be when these kinds of discussions come up? What's sort of the best medical advice, the best patient advice?
I think Rebecca mentioned this earlier. I think one of the best pieces of advice I could give is for involve family and friends. Anyone who you would want, who a patient would want in their decision should come to the appointments. That would be really helpful because so much gets lost in translation when it's, you take, in this case, she took home paperwork and is looking at that, but probably there was a discussion that was had in the clinic. And so being present for that discussion really helps the support people to have all the information.
Mm-hmm. And sometimes family members are afraid to speak up. I mean, I was speaking with a friend, a husband, one time, and he said, well, she might get mad at me. If I say something or if I say something in front of the doctor, she'll get mad at me for saying that, as we're in the clinic. And I said, well, you know what, she'll get over it. If it's in her best interest, she'll get over it. You need to say what you need to say as a family member, because if they hold that back and something, happens, then they feel bad about it. So say what you need to say. They love you, you love them, and it's in their best interest. So, you're there to support them, and they'll get over being angry at you.
Eventually they will. And one of the things that Beth was really grappling with in that discussion was, gosh, it could be a long time again, and I've already asked so much of you. I've asked so much of the family. So looking at that, I would think that could be daunting in terms of whether it's a surveillance study or something more involved than that, taking part in that, and for someone who has been ill and they're probably tired. So Rebecca, how do you help walk people through that if they have expressed those concerns just about the length of time that they would be involved in the process, as Lisa has been with this research study she's involved with?
Yes, we do. So any research study, the main focus point of the informed consent is making sure the participant understands what exactly is going on in the study. What's the length of the study? So that is very important for them to take into account before they even decide to participate in the study. And it's very helpful to have your support team there, your husband or other family members there to make sure, are you asking all the questions? Because maybe they may have thought of something else that you didn't think about. So having that support team there is very important.
And Lisa, is the time commitment Is that one of the greater concerns, do you think, for a lot of patients?
Probably, and if it's not right for them, then they would choose not to participate. But again, when you go into that study, you get a very big document. It tells you exactly what's going to happen each cycle of treatment, what's required. Oh, they're going to draw blood today. They're going to do this. They're going to even tell you how many milliliters of blood they're taking. I mean, everything is laid out so you can see it very clearly. And they'll say, well, you know, I had one day where I had to be there all day. And that was it in the 2 years. The other times I'm just there, you know, to get my infusion, which is, you know, relatively short amount of time. But you know, I was joking with the nurses that day, you got filing for me to do or something, but, you know, it wasn't horrific. And we've heard in the vignette about chemotherapy being so horrible. I think we need to allay that. Everybody's experience with chemotherapy is different with each and every drug you take. I have never had an experience where I was violently ill from my treatments, and there really is no reason to be that way. You call your doctor, there's enough medication to alleviate that. So, you know, that usually, you know, everybody's different, but usually that rarely, I think, happens with the drugs that we have to combat those symptoms.
Okay. And that kind of leads to the question of, how do I know if it's safe to participate in a research study? How do we calm those fears for someone who might have been invited, but they're worried about the safety of what they will be involved with? Dr. Daly, what would you advise?
There, you know, as mentioned before, there's a lot of oversight organizations that look over a study before it gets approved, before it reaches being offered to patients. Drug studies in particular are studied in cell lines and then in animals, and have a lot of regulatory carefulness. And in part, you see that reflected in the consent process. So, you know, Lisa's saying, oh my gosh, there's a long, long stack of things that I'm looking at. And part of that is because there is such attention to detail, including in that packet, they're describing in excruciating detail the side effects that may occur with the standard treatment, which actually, if you didn't participate in a study, you probably wouldn't hear in that level of detail. So there's a lot of oversight in terms of extra people involved. We mentioned that as well. So research nurses that are looking at labs and looking at scans and a whole other set of people. So from a safety point of view, the other thing I would mention, which kind of touches on what you said before too, is that it's personalized just like standard care is. So if a patient has a side effect, the drug is discontinued or the dose is reduced, or there's already built into every protocol how that would be done, which is true in standard oncology treatment as well, cancer care as well, is that if an individual patient has a different side effect, that a change is made, that's reacted to. So that's the same as standard treatment.
Okay. And did you feel like in the process that was how it went for you, in terms of you were fairly well assured of?
Most definitely.
Okay.
And you know, right now, since I'm only one time a month on chemotherapy, my research nurse calls me or emails me, how are you doing? How are you feeling? Any issues, any concerns? And then I respond back. But again, as well, adjusted. I've had dosage reduction. I've had change to help me better in the process. But yeah, most definitely, it's to me, it's just a win-win in participating in the research.
What about minorities? How important is that? I don't know if recruitment is the right word, but in terms of finding people to participate in these studies, is it more difficult to find people within certain minority groups or certain populations to take part in the studies? Is there a difference in the level of fear or maybe just some doubt that the patients will be treated well?
That is such an important question. I might cheer up because this is really a passion of mine. Minorities are underrepresented on clinical trials to a very disturbing degree, really, because we then cannot know any treatment differences that may occur among different races of patients. And despite most breast cancer trials being open to women generally, of all races, they're predominantly enrolling Caucasian women, not because there's any exclusion. And so it's really a problem to have good data to be able to offer our African American and our Asian and our Latino women, because we just don't have as much information. So I think that's probably a multifactorial reason why that occurs, but getting the word out through programs like this is so important so that we can really answer those questions, and we can't do it without patients of all ethnic backgrounds participating.
Right. And Rebecca, your role in that?
So our role in that is to go through HealthStreet, go out in the community, make sure that our advertisements are in all areas of the community, hopefully we can get these research participants in.
Okay. Have there been any recent breakthroughs in identifying which cancer genes, cancer cells need aggressive treatment and which do not? We're really getting into the science of it all here. Dr. Daly.
I think the cancer genes part I could kind of touch on. So different than the BRCA gene, which Lisa was mentioning, which is a gene on people, on individuals, on humans. The work in oncology research now is largely looking at the genes on tumors. And so to be kind of broad and vague, because it's a big question, a lot of trials are looking at patients whose tumors have a certain gene mutation and enrolling that really specific population to a drug that is targeted against that gene mutation. So many trials are involving biopsies. You kind of mentioned that in your story as well, to get a sample of the tumor and help to better subdivide patients for personalized medicine.
Okay.
But correctly, at this point, and this is why we need more research, more people to participate in research, because at this point, and they call it, correct me if I'm wrong, oncotyping. They're getting really into that, but they really don't know whether having a gene mutation will make you have better results with the therapy. They're not quite there yet to definitively say that. So they need more research, and more research is being done on many of these different oncotypes and protein inhibitors and things like that.
Okay. Do we have any other questions from the audience? We're getting close to the end of the program, but we wanted to make sure that we got everybody who had a question who's here tonight. Hello.
Hi, my name is Krista. When you were talking about cost and travel and that kind of thing, are there any research studies that are are all the research studies physically done here in Gainesville, or do you have any that are done via the mail or online for people who are willing and also meet the criteria that live in faraway areas and the rural areas, such as myself? And a second question, talking about minorities, are there any research studies for men who have had breast cancer or who have not had breast cancer? Thank you.
There are limited studies for men with breast cancer, although some studies broadly enroll all patients with breast cancer and don't require that participants be women. That's usually how male breast cancer patients have an opportunity to participate, is just a broad breast cancer study that would enroll all patients because it's such an uncommon patient population. In terms of treatment trials, it would be difficult to do them by mail or communication like that, but I think some of the survey type studies that Rebecca was mentioning would lend themselves well to that, like the ones your sister participates in. So things like gathering information about health behaviors and diagnoses could be done that way.
I was involved in a crest variant in California via the mail. That's why I was wondering if you had the same similar here in Gainesville.
I would be personally aware of the breast cancer trials. We don't have any currently that are by mail, but that doesn't mean, again, that none exist.
And did we answer both parts of your question? Okay. We do have one more Twitter question available, and I think we'll answer that just to make sure that we don't miss anybody who's been out in the audience watching us as we go along. How do patients find out the results of the research they're participants in? How do you know how it went? Dr. Daly.
Hopefully your oncologist tells you. That's the right answer, really, is that your cancer doctor is kind of keeping you up to date on what's going on. A lot of these studies that are bringing new drugs to market take years to report because there's a long follow-up to see how patients do. So when their active part of the treatment is done, there's a period of time, so there can be a lapse of years till you find out, but your oncologist should be letting you know.
And if they're not, can you kind of pick up the phone and call them and say, hey,
of course,
when will you be able to tell me something?
Yes.
Good, okay. Staying informed, that's a big part of the process. And Lisa, for you, did you feel like you were well informed along the way and have been so far?
Yes, and most definitely, and you know, I was privy to any test results, blood work, scans. Of course, they discuss that with you at every appointment. In general, how was the whole group doing? No, I didn't have that information, and as you said, that probably wouldn't be available until it was published. But I did have my friend that I knew, and so I knew how she was doing in contrast to me. So that was, you know, interesting to be able to have. But most definitely, they do discuss your information. Your personal information, and share that with you and your doctors so that that can be used.
Well, this has been, I think, a very important and very enlightening discussion with the three of you. Thank you so much for taking your time to be here to answer questions and to explain how it all works. Always trying to find new ways to help people find information about cancer research studies and help them through the process. Let us know what you think would be most helpful. Thank you again to our panelists and to our audience for being with us tonight.